When talking about constipation, especially, it is important to make sure that we rule out some red flags, and that is if they notice any blood in the stools or any dark colored stools, that means altered blood in the stools, or if they have gained a lot of weight or lost especially a lot of weight, or any significant pain that's associated with this. More importantly, they should have had their routine colonoscopies, and that is important. And every few years or every 10 years, if they had routine colonoscopies, that would be fine. If there are no red flags and we've looked at the medical history and their medications and everything else checks out, then in most cases, no further specific workup needs to be done. Then we can consider this to be just chronic idiopathic constipation. That means of no known cause, and manage it as such. The history is very important, asking the patients as to how often does she have a bowel movement, what was her previous story, how many years or months has she had this problem, why did she think it started, and what has she done to help with the constipation. Most patients have tried at least over-the-counter stool softeners to help with this constipation, and then what response has she had. Equally important it is to understand that is she straining a lot to have a bowel movement. In a woman especially, does she put her fingers at the perineum between the vagina and the rectum or inside the vagina to push it back and try to expel the stools? Some women even put a finger in the rectum and try to extract the stools out. That is how much bothersome that constipation can be. So history is important to understand not only what medications she's taking, what medical conditions she has, but her history of constipation and how frequently it happens and how much it is bothering her quality of life. Once we do that, then we do a proper urogynecologic examination.